My name is Jim Yong Kim. I'm president of the World Bank Group, and I'm very happy to be on Whose Time.
随着全球人口的结构变化，老龄化加剧，医改已经成为世界性的难题。在这个话题上呢，与其他国际组织领导人相比，世界银行第一位内科医学出身、主攻发展问题的行长金庸显然更有发言权。金庸1959年8月出生于韩国首尔，5岁随父母移民美国，后来呢获得了布朗大学的文学学士学位、哈佛大学医学及人类学的博士学位，曾任哈佛医学院全球健康与社会医学系主任。2009年的7月，担任达特茅斯学院院长，也是常春藤名校的首位亚裔校长。2012年的3月23日，获美国总统奥巴马提名出任世界银行行长。同年的4月16日，由世行理事会任命为新行长，自7月1日起开始，为期5年的任期。对于中国的医改进程，金庸一直以来都十分重视。今年7月底，他来到中国，先后访问了福建和安徽的医疗机构。之后呢，在北京与中国国务院总理李克强会面，并出席了中国医药卫生改革联合研究报告发布会。报告是由世界银行集团、世界卫生组织、财政部、国家卫生和计划生育委员会、人力资源和社会保障部共同完成的，为中国医改提出战略性的改革方向。发布会结束之后呢，金庸在世界银行北京驻华代表处接受了财新时间的专访。
During working on this report, what kind of messages do you get from the Chinese leadership?
Absolute commitment. I mean, Premier Li Keqiang couldn't be more committed to this. So we have very strong commitment. And in this case, it was interesting because we had to have 3 different ministries work together. There was the Ministry of Finance, Ministry of Health, but also the Ministry of Human Resources and Social Security. So that was actually complicated at first. They don't naturally, work so closely together. But at the end, we got all 3 of them to embrace the report, embrace the direction that we're going in, and we'll be working with all 3 on the pilot projects in Sanming and Anhui.
Mm-hmm. Could you talk more about the projects after this report?
So it's going to be a $600 million, and it's going to actually $600 million for these 2. And it's actually going to become the largest project that China has right now in terms of dollar volume. So what we'll do is, based on the 8 levers, the 8 key interventions, we'll do an assessment of each of the 2 provinces, and then come up with a plan in each of them where we'll tackle all 8 of the elements of reform, and then try to scale it up to the entire province.
What area would the World Bank to work with China in the health reforms?
Well, so we'll provide the financing, of course, but we'll help with everything from collecting experiences from other countries. We'll bring in experts from other countries. We'll support them in whatever way that they find necessary. But my plan is that we'll be very involved, and I've promised leaders in both provinces that I will come back regularly because the stakes are high. I think if we get this right in China, the example in China will be useful for just about any low or middle income country that is facing the same problems.
2008年以来，中国卫生总费用的增长明显。根据经合组织最近的一项研究测算显示呢，如果不采取有效的成本控制措施，那么在未来的40年，中国政府的医疗卫生及长期护理支出占 GDP 的比重将是目前的3倍。金庸表示，中国应该从美国和欧盟医改中吸取教训，减少不必要的医疗支出，通过控制药价、完善基层医疗、发展互联网会诊技术等，来进一步的降低医疗服务的成本。
In China, many Chinese citizens complain about how difficult and expensive to see a doctor. But as more Chinese go overseas, now they realize, well, it might be also difficult and expensive to see a doctor in the Western countries, such as the US or in the EU. So my first question would be, is this a global issue?
Healthcare is one of the most complex sectors. Kenneth Arrow, a Nobel Prize-winning economist, pointed out that health is one of the areas where markets fail. And when you try to solve a problem through the market, it often leads to very strange outcomes. So actually, I don't know a single country in the world that does not have problems with healthcare. So there's great complexity, a huge amount of cost, and so it should not be any surprise at all that a country as large as China that has tried to scale up its healthcare system, scale up the coverage, is going to have things that it needs to work on in terms of health reform.
In terms of health reforms, what are the lessons China can learn from the US or the EU?
Well, some of the lessons that China can learn are to not do what they did. We say to China very strongly, please do not replicate the American healthcare system. It's 17% of GDP, and estimates are that anywhere from 30 to 50% of health expenditures in the United States are either unnecessary or even harmful. Right? So we don't want China to replicate those mistakes. But China is on a rapidly growing path, and we want them to get the best of the healthcare systems all over the world. So, for example, Sweden has parts of its healthcare system that are very well organized. Turkey has parts of its healthcare system that are very well organized. Even Rwanda in Africa has parts of its healthcare system that are well organized. But that's what we do at the World Bank Group. We work in all of those places. We don't work in Sweden, but we certainly have experts who know about the Swedish healthcare system, and we bring all those experiences to China. Now, it turns out that even within China, there are areas that are very innovative. So I was just in Sanming City and Anhui Province. In both of those areas, there are tremendous innovations happening right now. What we're going to do with those two areas, we're going to scale up what's happening there, but then also take those lessons and spread them all over China, but also eventually spread them all over the world.
You talk about your visit to Sanming and to Anhui Province. Could you elaborate more on that? Like, what surprised you most and what interests you most?
Well, what inspired me most in Sanming and Anhui is the great courage of the medical doctors and also the leaders. So in Sanming Province, they realized that the cost of drugs for patients was 4 times the cost of drugs as they were coming out of the drug company. So in other words, many people were charging extra and it was unnecessary. So under threats coming from the people who were benefiting from that system, the leaders, the medical doctors eliminated those extra costs in pharmaceuticals and had the courage to do it. Now what they were able to do is take the money that they saved from having to pay so much for the drugs and put it right back in the system, and were able to increase the doctors' salaries 2.5 times. So the doctors didn't feel like they had to sell these drugs. The doctors didn't feel like they had to go and earn money elsewhere. So that was both courageous and innovative. In Anhui, they've even taken it further, and they've used the payment system to force the local, the village, the town, and the district hospitals to work much more closely together. They've even utilized technology like video conferencing to help with the referral process. So there are some really, really wonderful innovations already going on in China that can be spread. But of course, every system can do better, so we have a very ambitious program for each of those areas.
It seems like a dilemma in China. On one hand, the patients complain about how expensive to see a doctor, but on the other hand, the doctors complain about their low income, low salaries. So I guess my question is, where does the money go?
The problem in healthcare is there's always something new. There's always a new piece of equipment. There's always a new test. If you want, you can spend literally tens, even hundreds of thousands of dollars getting yourself diagnosed. This study, that study, the other study. So the technology is constantly expanding. And so if you don't go forward with a strategic view and say, which of those things do we really need now, and which of those things do we not need, and do it on the basis of clinical need, then essentially your healthcare expenditures could be almost infinite. The cost, we think, it has to be shifted. We think that there are ways that China can put more money into health personnel and less money into these huge 8,000 bed hospitals that are now all over China. Right now, the large teaching hospitals, large tertiary care hospitals are providing all the care for some patients, including primary care. It just makes no sense. We think that if we do it right, we can provide much more care for the Chinese people at a much lower cost, because it will be organized better. For the simple problems, they'll go to their local clinic. For the problems that are a bit more complicated, they'll go to the next level. And only for those cases that can only be handled at the tertiary care centers will those patients be referred up. But the use of technology, right? You have an iPad, you can do FaceTime. You could literally do FaceTime-based diagnosis, connecting the specialist doctor even to the village level. If we do that, both the outcomes will get better and the costs will go down. That's what real value is, better outcomes at a lower price. And we know already that there are examples in China where they've done that, and there are of course examples all over the world that if we bring them to China, we think the system can get much better.
It's very interesting because China now emphasizes the concept of Internet Plus. So I was wondering, what do you think of the role of Internet in this whole blueprint of health reform?
The Internet can play a very important role, and again, as I said, I saw this in Anhui, where there was an elderly woman who had fractured her hip, and the people at the place that she went first didn't have the expertise in how to fix it. And so they just put her x-rays and her medical records on the video conference, and they spoke back and forth, and now they have a plan for her that makes perfect sense. So in that sense, just the communication piece of it, but also ultimately having a really good electronic medical record will be helpful. And again, there are countries that have done that really well. Korea, for example, has one of the best medical record systems in the world, and we would be very happy to bring those examples to China.
在中国，医患关系已经成为近年来舆论的焦点话题之一。据调查显示，目前医疗纠纷有明显增加的趋势，以医务人员为攻击对象的医闹事件时有发生。对此，金庸表示，要处理好医患关系，就需要改变当前医疗行业以经济利益为导向的激励机制，建立患者治疗效果优先的医疗体系。同时呢，也要让患者熟悉和了解医疗卫生体制，并积极的参与就医过程。
This has become such a thorny issue in China because, as we can see, that more and more cases against violence against healthcare providers in recent years. So, I guess what do you have any advice on that?
Well, I don't know the specifics of these cases, but of course, hundreds of physicians and healthcare workers getting attacked is very worrisome. The conclusion that they came with in Sanming and Anhui is the incentives are all wrong. That the incentives are to sell medicines. The incentives are to sell diagnostic tests. The incentives are very financial instead of being incentivized to have the best outcome for the patient. If you're held accountable not for how many patients you see or how many drugs you sell, but if you're held accountable for the overall outcome of your patients, that will change your practice very, very quickly. And so we're very excited because at the highest level here in China, they're committed to moving toward a system where outcomes for patients are the #1 priority. And again, it seems very complicated, and it's pretty complicated. It is complicated, but there are places in the world that have solved this problem. We're going to bring those solutions and try to make them work here in China.
Could you elaborate more on that? Does this relations between patients and doctors become an issue in other parts of the world?
Sure, there are places, but where it really makes sense is when there are family doctors who are in charge of the entire patient. It also makes sense when you get a certain amount of money, a doctor gets a certain amount of money for taking care of a patient, right? And that money has to be used in keeping the patients as healthy as possible, right? And so there are ways of incentivizing so that at the end of any given year or 2 years or 3 years, the healthier your patients are, the better you do financially, right? Now, the incentives are aligned. For example, the insurance companies in the United States, they're very incentivized to keep patients healthy. So you see some insurance plans providing support for membership in gyms. You see them providing very careful monitoring of the things that you need to monitor every year. Mammography or colonoscopy, these things that you need to do on a regular basis. They're very aggressive at making sure that everyone that they insure gets those things. So it's possible. If you get the incentives lined in just the right way, you can have a system that is less expensive while at the same time delivering better outcomes.
So as the report mentioned that it's people-centered. So I was wondering, what do you think would be the role of patients in health reforms in China?
The role of patients is one of the 8 major goals of this reform. That patients have to be in the center. They have to be better informed. So part of it is that I think it's very important for patients to get more education. So now, when I went to Anhui, I saw a group of people that did nothing but patient education. 2 nurses whose full-time job was to provide information and education to the patients who came to the hospital. I think that's a very important innovation. The patients can't by themselves determine which kind of cancer chemotherapy they need. Right? But patients on their own can make very clear decisions about whether they felt that they were treated well, whether they felt that the doctors or the nurses actually listened to what was going on with them, and then how quickly and effectively and efficiently the care process went. And so holding physicians and the health system accountable for not only outcomes of patients, but patient satisfaction, that too will change the practices.
What about the role of doctors in health reforms?
You know, the doctors should play a very important role in health reform, of course, but there has to be a conversation across all stakeholders, not just doctors, because what we've seen in health systems all over the world is if you ask doctors how a health system should be organized, they'll think of it mostly in terms of what they know. And very few doctors have training in management. Very few doctors have training in things like drug procurement, right? So you need a cross-sectoral group of people to all work together to get the kind of health system you want.
公立医院改革是深化中国医改的重点任务之一，有一系列的问题迫切需要通过体制机制改革逐步的加以解决。公立医院逐利机制有待破除，外部治理和内部管理水平有待提升，人事薪酬制度有待健全，结构布局也有待优化。金庸建议，中国的公立医院改革过程中呢，一是要改变医院的盈利方式，不应该过度的看重患者的数量与药物的销量；二是要对医疗行业各层级进行统筹和协调；三是要确保患者的治疗效果，同时保证治疗效果对公众透明。
The report also mentioned about the reform of public hospitals. Could you give me like the top 3 challenges you can see in the reform?
I think the first thing is we have to change the way that hospitals are paid, because the incentives are just wrong. The incentives are moving in a direction that focuses on volume, drug sales. We've got to get the payment system right. Another issue is that there has to be coordination between all levels of the healthcare system, and a single hospital shouldn't provide primary care, secondary care, tertiary care. And I think the other big issue for the Chinese healthcare system is that you've really got to have a way of making sure that the patient outcome is the most important thing at the end of the day, right? And we're not really following outcomes in a hospital. What we're following is volume, number of patients seen, number of procedures done. And so that shift so that hospitals are held accountable for their outcomes is new. And it's not like every country in the world has done this. There's a group in the UK that simply published the outcome data on all the different hospitals in the United Kingdom. And at first it was very controversial. And some of the hospitals said, well, the reason the deaths are so much higher is because our patients are more complicated. So then they looked at that data and asked the question, are the patients more complicated? And they found out, well, actually that's not true. There's no increase in complexity, you just have a higher death rate, right? So once that all came online, then patients started to be able to see, well, maybe I won't go to that hospital because the death rates are higher there or the complication rates are higher there. I think we have to go in that direction where not only are we focused on outcomes, but we're very transparent about which hospitals are getting good outcomes versus others.
It has become a phenomenon in Chinese hospitals, I mean the public hospitals, is that there's some mega hospitals, like, correct me if I'm wrong, like China now has the largest hospital in Asia with more than 7,000. So I was wondering, how do you see the expansion of such hospitals in China?
Well, when we first started talking about this, the discussion was that some people in the Ministry of Health thought that the solution to China's healthcare problem is just to build more 7,000, 8,000 bed hospitals. And the Ministry of Finance was worried about that. So I think it's hard to run a 7,000 bed. I mean, I worked in an 800 bed hospital. That was hard to run. I think there has to be a shift. Right now, the number of hospital beds per population in China is the equivalent of OECD countries. So we've probably built enough hospital beds. Now they're not located in the best places. We may need to build some in the more remote locations. But I don't think the task is to build more hospitals with beds. The task is really to make sure that these big hospitals, that are the tertiary care hospitals, are linked to other institutions all the way down to the village level.
The heat of investment in healthcare system in China now is rising, and some people say that it's already overheated. So I was wondering, what do you think?
Well, it's 5% of GDP, right? And so, you know, one of the best healthcare systems in the world is the Singapore healthcare system, and they're only spending 4% of GDP. Well, actually going toward 5% now. But, you know, the U.S. is 17%, and most OECD countries are between 7 and 12% of GDP. So I think the Chinese health expenditures will go up a bit. I don't think right now it's the overall amount of spending that's the issue. It's the efficiency and effectiveness of the spending, which is what we're focused on with the reform.